Hi, and welcome. I'm Amber, co-founder and counselor at Convenient Colorado Counseling. And today we're going to talk about generalized anxiety disorders. So before we start talking about generalized anxiety disorders, first I'm going to share with you what anxiety is. Anxiety is a feeling of worry, nervousness, or unease. So you might have felt anxiety when studying for a big test or getting ready for an important work presentation. And anxiety as a feeling can be motivating to prepare for things like that test to make sure that you pass, or things like that work presentation to make sure that you're impressing whoever your audience is. You also might have experienced anxiety when making a big life decision or giving a presentation or speech. But after that event, that anxiety usually goes away or that feeling lessens when it's over. But for 3% of people, that anxiety doesn't go away and those feelings might become worse. And that's when it's tipping more over into the disorder. And generalized anxiety disorder, I want to talk to you about that one today because it's one of the top 5 anxiety disorders that people might experience. So, you might be here because you have a loved one with generalized anxiety disorder. Maybe you're feeling more anxious and you're wondering if it's time to seek some help yourself. Or you've been diagnosed with generalized anxiety disorder and you just want to maybe understand it a little bit better. And I hope to help with whatever the reason is that you're here today. So, when looking at a diagnosis for generalized anxiety disorder, your provider is going to look at the Diagnostic and Statistical Manual 5, and there's different criteria that you must meet in order to be diagnosed with generalized anxiety disorder. So the first thing is excessive worry. So excessive worry is when you're worrying about something more days than not for a period of 6 months or longer. And also you're finding it just really hard to control that worry. Maybe you know that you're worrying too much about something, or you know that it's irrational, the thing that you're worrying about, but you still just can't quite stop yourself. Then there's also some things that you may experience, like you're feeling restless or on edge, you're feeling tired or fatigued easily, you're finding it harder to concentrate, you're feeling more irritable, or maybe your loved ones are telling you that you're more irritable. You're having muscle tension, so maybe your body hurts from that. And you're having sleep disturbances. So that might look like it's hard to fall asleep or get up in the morning, waking up more at night, whatever that might look like for you. And then a really big one is that it's affecting daily living. So it's affecting you maybe at work, at home, at school, the different settings in your life that weren't affected before by this excessive feeling of worry and anxiousness. If you're seeing a therapist, or if you do see a therapist or a provider, they're also going to look at and make sure that these feelings aren't tied to other substance uses like alcohol or drugs, and there's not a different kind of underlying diagnosis that's causing this anxiety. So that's kind of what it means when you're diagnosed with a generalized anxiety disorder. And you're not alone. Like I said, everyone has some level of worry and anxiety, and there are ways to feel better and to live your life and find your joy again. People with generalized anxiety disorder typically find psychotherapy or like therapy counseling services helpful, and sometimes coupling that with medication can be really helpful as well. So if you're already doing that, that is awesome. I'm so happy that you made that step. And if you have a loved one or if you're still kind of debating it, I encourage you to find someone in your area that you can talk to about this if this kind of sounds like you. Well, I hope this was helpful. I know it was just kind of a little blurb on generalized anxiety disorder, and I'll cover other anxiety disorders in some of my other videos as well. I will post weekly covering different disorders, hopefully making them a little less scary and a little more understandable, debunking different mental health myths, and providing some tips and tricks for more mental health wellness. If this sounds like something that would be helpful to you or a loved one, please like or subscribe. Thank you so much for joining me today.